Hey there, health enthusiasts. Welcome back to our channel where we dive deep into the fascinating world of medicine and wellness. Today, we're tackling a topic called irritable bowel syndrome, or IBS. So, grab a seat, buckle up, and let's embark on this enlightening journey together. Irritable bowel syndrome is a functional gastrointestinal disorder typified by changes in bowel habits and abdominal pain. It is a persistent relapsing illness marked by recurring, variable intensity symptoms. Changes in colonic transit, psychosomatic symptoms of stress or anxiety, improper toileting behaviors, food intolerance, pain sensitivity, and post-infectious issues are linked to the illness. Prevalent in women than in men and adolescents age. A patient presenting with this condition can be either diarrhea predominant, constipation predominant, mixed where they can have diarrhea and constipation. So the patient can have constipation, which can be painful. In diarrhea, small amounts of loose stool are typical, with urgency or frequent bowel movements preceding the evacuation phase. Postprandial urgency is also as typical. There can be alternation between constipation and diarrhea. Diffuse abdominal pain is common, with the lower abdomen being one of the common pain locations. Sharp pain bouts can happen suddenly. Pain might be exacerbated by meals, and it is often alleviated by defecation. Abdominal bloating and clear or white mucus in the stools can also be present. Make sure to ask and assess if any alarm symptoms are present. The Rome-4 criteria is used for the diagnosis of irritable bowel syndrome. Recurrent abdominal pain on average at least 1 day per week during the previous 3 months that is associated with 2 or more of the following. Related to defecation, may be increased or unchanged by defecation. Associated with a change in stool frequency. Associated with a change in stool form or appearance. A proper history and examination can make the diagnosis. Investigations are used to exclude other causes and assess the status of the patient. Complete blood count, erythrocyte sedimentation rate, C-reactive protein and iron studies. Stool examinations to exclude infectious causes. Thyroid function tests. Celiac disease serology. Fecal calprotectin. Abdominal computed tomography scanning is appropriate to screen for tumors, obstruction, and pancreatic disease if suggested. Colonoscopy is appropriate to assess for inflammation, obstruction, or if alarm/warning symptoms are present such as bleeding, anemia, chronic diarrhea, older age, history of colon polyps, family history, or constitutional symptoms, such as weight loss or anorexia. The mainstays of managing irritable bowel syndrome are dietary recommendations and psychological support, which includes cognitive behavioral therapy, hypnotherapy. Fiber intake with drinking enough water, especially if constipated. Avoid coffee, alcohol, soft drinks, fatty and spicy foods, as well as lactose and fructose, as these may be aggravating factors. Meals devoid of gluten may be beneficial for persons with irritable bowel syndrome because gluten intolerance has been linked to the condition. Diets low in FODMAPs. Pharmacological management for the symptoms if the symptoms are severe or they are impacting the quality of life. Include antidiarrheals such as loperamide, anticholinergics, tricyclic antidepressants, prokinetic agents, bulk-forming laxatives, serotonin receptor antagonists, chloride channel activators, and guanylate cyclase C agonists. Thank you so much for joining us today. If you found this video helpful, don't forget to like, share, and subscribe for more content. And as always, take care of yourselves and each other. Until next time, stay well.